Today I will be talking about how to manage COVID-19 symptoms at home. Second wave of COVID is spreading fast in India and affecting a lot of people. Please be watchful, and if you experience slightest of the symptom, please quarantine yourself so that you protect your family members. First and foremost, if you or your family member have tested positive, please don't fear and panic. Stay calm and make a positive vision that all will be well soon. Believe it or not, it works. Stay away from negative people and negative news. Talk to people who inspire you and make you feel positive. Be it a professional or any family member, but only talk to positive people. Monitor your symptoms closely and note the vital signs at least 2 to 3 times a day. Body temperature. A high-grade fever more than 101 for more than 3 days raises concern. Pulse rate. A consistent pulse rate above 105 is a worry. Blood pressure. A very low or a very high blood pressure needs attention. Oxygen saturation. Oxygen levels should not drop below 95. Be in close communication with your healthcare provider so they can oversee any necessary changes in the medication regimen. Individuals with COVID-19 should continue to take their regular medicines for high blood pressure, diabetes, for heart disease or any other disorder. By keeping these conditions under control, it will certainly help you recover from COVID-19. Epidemiologists say that 80% of people with COVID-19 are either asymptomatic or have mild symptoms and can recover at home. Let's look at the common symptoms of COVID-19 and how it can be managed with home care. This is probably one of the first symptoms of COVID. When you have a sore throat, eat soft foods and drink warm fluids that soothe the throat. You can improve your sore throat by drinking hot water with ginger and honey. Gargles help a lot. You must do pink salt water gargles at least 3 times a day. This will soothe the throat, reduce the viral load and help in faster recovery. If it's really bad, you can try betadine gargles. If it's a low-grade fever, it's not so much to worry. But if you continue to have a high-grade fever that is more than 101, you must check with your healthcare provider to decide the further course of action. Fatigue is a symptom which is seen during and post-COVID infection too. Rest and give your body time to heal. But you don't want to spend the whole day in bed. Get up and move often. This is important for reducing the risk of blood clots. Also, it is important that you walk and exercise your lungs. It is recommended that you walk and take deep breaths and cough to clear mucus from your lungs. Coronavirus binds with the protein ACE2, which is found abundantly on the cells of nose and mouth. One more possibility is that it could invade the nerve cells which are associated with sense of smell and taste. Smell training is recommended to recover from sense of smell. How do you do that? Sniff on essential oils like eucalyptus oil, clove oil, or you can take steam with eucalyptus oil, as nasal congestion could also cause loss of smell. If you are experiencing shortness of breath, make sure you are eating small meals rather than big meals. Also, lying down on the stomach as opposed to your back will help. It helps in improving blood and oxygen supply to the lungs. Coronavirus causes chemical histamine to rise in the body, which possibly may be the reason for rash. Avoid histamine-rich foods like banana, avocado, tomato, spinach, fermented foods. Antihistamine foods include turmeric, apple, guava. Coronavirus affects gastrointestinal system for many. When there is diarrhea, you need to eat easily digestible foods like rice and dal, khichdi. Avoid fiber-rich foods like papaya, guava, peas, broccoli, beans. Make sure you include a course of probiotic with the antibiotic course. This will help to replenish good bacteria in the gut. Dehydration is very common in diarrhea, so drink plenty of fluids like ORS, soup broths and water. Best remedy for dry mouth is plenty of fluids. Along with water, drink coconut water, eat water-loaded fruits like watermelon. These are good sources of potassium, which is required to maintain the electrolyte balance. Honey with warm water, tulsi herbal tea, clear soup broths is what can soothe a dry cough. When you have dry cough, keep a small piece of ginger in your mouth so you won't cough continuously. Steam is the best treatment for nasal congestion. It clears up nasal passages. Also, consuming an anti-inflammatory like turmeric helps. Fresh turmeric root with black pepper and ghee is the ideal way to consume it. But if you have diarrhea, avoid it. Anti-inflammatory foods like turmeric, ginger and garlic help to reduce muscle ache and joint pains. But avoid when you have an upset stomach. Hot and cold packs to the painful area can help to give some symptomatic relief. If you feel better within 7 to 9 days, it is a good sign. But if you see worsening of shortness of breath, increasing chest pain, uncontrollable fever, mental confusion, increasing lethargy, severe dehydration, if you are turning blue around your nails and lips, you need to escalate the matter and talk to your healthcare provider regarding the same. Acting upon it timely surely helps. If you or your family member has COVID-19 right now, I wish you a speedy recovery. Get well soon. And remember, positivity works like magic. Be positive and spread positivity. If you found this video interesting, do subscribe to my channel. Make sure you do it now so that you don't miss out on my future videos.